Hi, my name's Faye. I'm a mental health practitioner and I work for Greater Manchester Mental Health Trust within the NHS. My role as a mental health practitioner is to work across the GP surgeries in central Manchester. I work under a living well model, which is hopefully going to bridge the gap between primary and secondary care mental health services. Well, as a nurse, there's no typical working day, but my main role is to conduct mental health assessments with patients that might have been referred to me from the GP. Usually they're patients with more complex needs. And from there, I give them some face-to-face time, a bit more space than the GPs can give them. We talk about their needs in a holistic way. That means that I'll usually conduct referrals to outside agencies, not just community mental health teams, but also charity-based services in central Manchester, drug and alcohol services, psychological therapy services, whatever the patients need. And then I would normally do a follow-up assessment after that just to check that everything's in place. But as I say, every day is a little bit different and it's quite a busy job. I personally feel that this role is essential in the GP surgeries. It's been such a rewarding and valuable role. I've received really positive feedback, not just from the GPs and the pharmacists and everyone else that works in there, but also from the patients themselves. And we gathered some feedback recently actually from the patients. We sent out a text message across to all the people that I'd seen over the last 2 years, and we've received really good feedback. People have said things like it's the best mental health care they've received, in comparison to the secondary care services. It's so easily accessible as well, so people can ring the surgeries, make an appointment with me to discuss their mental health. I give them that time that GPs can't give, so the feedback has been really positive. And I think that alone shows what difference we've made. I think I'm very lucky that I've got a very good manager who provides a lot of emotional support, meets up with me regularly for managerial supervision, but the role itself is isolating. It's something that's very new to me. I've been used to being in big teams, on the wards, in A&E, so this has been something that I've had to adjust to, but I think as long as you build those relationships with the GP practices, with people around you, make sure that you have regular supervision, I think that for me has worked, as well as having teams that you can link in with and just building those rapports, and I think I've made the effort to do that, so yeah, I feel supported as I am.